Hello, this is Dr. Ashkan Lashkari, President of MOASC, and today we have the honor of interviewing Dr. Elizabeth Brem, Associate Professor at the University of California, Irvine, and we honor her as our Researcher of the Month for January 2023. And Dr. Brem, thank you so much for agreeing to be here with us.
Of course, thank you so much for the honor.
So as part of our monthly interview, we'd like to get to know a little bit about you. And so perhaps you can share with us some of your areas of clinical research interests.
Yeah, my clinical practice is pretty wide ranging, everything from low-grade lymphomas to high-grade lymphomas to CLL to a little bit of plasma cell disorders as well. So I do have studies open in kind of all of those disease groups, but in terms of ones I'm leading on my own, well, not on my own, but ones that I'm leading are the primary one right now is S1918, which is a study of older patients age 75 and older with diffuse large B-cell lymphoma. We're looking at our mini CHOP with or without oral azacitidine. So that's an intergroup study. We are currently on a brief hold to kind of just look at a couple of safety things, but we should be able to reopen relatively soon. I'm hoping in February. And one of the things I'm most excited about with that study is not just the therapeutic question, but we're looking at surveys of people's functioning, these comprehensive geriatric assessments at different time points of the patient's treatment course to kind of understand both the short and the long-term effects of chemoimmunotherapy on the functioning of our older patients. So I think we have a lot to learn. Our geriatric colleagues have been encouraging us to do these assessments for a long time. So I think that regardless of the therapeutic answer we find, we're actually just going to learn a lot about taking care of this group of patients. You are on mute.
Are there other trials that you are also excited about as it relates to other areas of your clinical interests?
Yeah, so I mean, there's a ton of amazing things out there. This is a really exciting time to be in oncology. I feel like a lot of our paradigms are shifting as we move away from cytotoxic chemotherapy and towards oral therapies, bispecifics. All these things are going to dramatically change how we treat patients over the next couple of years. So there's some really interesting studies kind of being developed in the intergroups, kind of looking at the best time to kind of utilize some of these new therapies like bispecific antibodies. Should we maybe use them earlier in disease courses? Could that change the history of the disease? On my personal end, one of the other things I'm working with on is I have a clinical basic science colleague here whose name is Dr. David Fruman, who's done a lot of work over the years on the B-cell receptor signaling pathway and found out that actually, believe it or not, statins modulate expressions of BCL2 family members, right? So BCL2, part in apoptosis, target of venetoclax. So we have some preclinical data suggesting that potentially using a statin in combination with venetoclax-based therapy could be beneficial. So we're finishing a phase 1 study of that right now, looking at adding pitavastatin to standard of care therapy for CLL and AML, so patients who are going to get venetoclax-based therapy anyway. And we are in the process right now of developing the phase 2 and figuring out exactly what that's going to look like.
Well, that's very exciting. I think we are all very excited by the advances being made in oncology, particularly I think hematological malignancies are certainly pushing us forward in terms of using immunotherapy in the form of CAR T-cell and, as you mentioned, bispecific antibodies. And I think being able to translate who we can use these patients on and whether we can put patients on them earlier is going to help, improve their outcomes. And so I think these are all questions we're very excited to learn more about. Thank you so much for meeting with us and opening up the door to what it is that you're doing and exploring. And so we look forward to learning more about these studies as they come about. And what we're going to do is we're going to attach some of the trials that you mentioned on this brief interview as a way for our membership to learn more about them and perhaps even refer if they're interested. So
absolutely happy to hear from anyone at any time if I can be of help.
Thank you so much, Dr. Brem. Have a wonderful afternoon. Thank you again.
You too. Bye-bye.
Bye bye.